Nobody prepares you for how strange the first few weeks after bariatric surgery can feel. Not just physically, emotionally too. I'm Grace, and I'm a physician assistant with 20 years of experience in bariatric surgery and most recently endoscopic and anti-obesity medications. Week 1. The first few days after surgery are usually the hardest. You're sore, you're tired, you're adjusting to a completely different routine. Most patients describe the soreness less like sharp pain, but more like they did 100 sit-ups the day before. So more of a muscle soreness feeling. You may also feel weak or tired during this time because your body is healing and your intake is still very limited. And honestly, during this time, many patients wonder if they made the wrong decision. So don't worry, that's normal. And that thought doesn't mean you failed. It just means you and your body are adjusting to a major change. Week 2. By the second week, most patients are starting to feel noticeably better. Nausea is usually improving. Walking feels easier. Many people are returning to work. And this is where most patients begin to realize how physically aware they are of their abdominal incisions. Here's some more real-life things most patients aren't warned about before surgery. Tight clothing may irritate incision sites. For instance, waistbands may feel uncomfortable. Because of these surgical sites, you may want to buy a few pair of pants that are allowed in your workplace but are comfortable and do not place too much pressure on these incision sites. And for women specifically, bras may become surprisingly annoying during this phase. So a lot of women prefer soft, loose-fitting sports bras, or sometimes even something called boob tape. This can help temporarily just to avoid applying pressure to the upper abdominal incision, since as you can see, it's located exactly where your bra strap goes. I didn't know boob tape was a thing until one of my patients told me about it, and it really works. So I just wanted to show it to you and see what I'm talking about. So this includes nipple covers too, since you won't be wearing a bra. And then just to kind of show you what the tape looks like. Now I've already kind of opened this so you can see it. So it looks like this, and then you just cut it as far as you need it. And then this just kind of peels back. And then you can put the tape on over where the cover is and then just kind of pull things up. I'm going to put the Amazon link for this brand down in the video description in case you want to check it out. There's plenty of videos out there covering the specifics of how to use this. And there's different ways you can put it on and all that. Just make sure, I would say, whenever you're applying it, probably not a good idea to put it over any of your surgical incisions, so you definitely want to avoid those because this is super sticky. So if it goes on a surgical incision, that's not going to be comfortable at all. But anyway, this is it. Back to the video. Weeks 3 through 6. By the soft food phase, most patients start to feel like they're becoming human again. You can finally eat something besides liquids. Energy is improving, clothes are fitting differently, and emotionally, many patients start feeling hopeful again. But your body is still healing during this phase. So even if you're starting to feel better, this is not the time to overdo it or rush the process. Week 7. By week 7, most patients are emotionally relieved to return to solid foods again. And physically, this is usually when most people start to feel normal overall. But the one thing people don't always expect is how emotional this phase can feel, especially as they begin eating out in social situations again. Because your relationship with food has changed, and your body is healing while your brain is trying to catch up. And that's why I always tell patients, don't judge the entire surgery experience based on the first several weeks after surgery, because that time is recovery, not the final outcome. And hey, if you're interested, I'm linking a free PDF in the video description that describes the bariatric surgery post-op stages, from pre-op through solid food. Just click on the link below. And if you're trying to understand what life after bariatric surgery actually looks and feels like, that's exactly what we do here on this channel. I release 3 videos a week to help you understand and think through all the options available in the professional weight loss world. So subscribe if you want more of this kind of content. Thanks for watching, and I'll see you in the next video.